Peace, blessings, and abundance, everyone. Welcome back to another episode of Sacred Birth Sessions. I am Jessica Pierre, birth doula, educator, and creator of the Sacred Birth Blueprint. This space is for women who want more than just surface leveled birth advice and who want to feel more informed, confident, and not blindsided when it's time to give birth. So take a breath, settle in, and let's get into today's session. So let's talk about something that a lot of women say they want, but don't always know how to get there. And that's feeling confident going into birth. Not just hoping things will go well, but actually feeling prepared. I know we talked about this in previous episodes about being prepared and having all the tools and support and everything, but how do you do that? So when I say confidence, I don't mean feeling like you have everything figured out, because birth just doesn't work that way. You may think you know everything or know how to maneuver everything, but trust me, there's going to be some things that, you'll be a little unsure about. So, like I said, I don't mean feeling like you have everything figured out. I really just mean feeling grounded. Even if things don't go exactly how you imagined, just being able to remain grounded and secure. So, confidence itself in birth isn't something that just shows up when labor starts. It's something that's built way beforehand. So you have to prepare yourself as early as possible in order to go into that labor and delivery room as confident as you would like. It comes from, like I said, how you prepare. Not only how you prepared, but what you learn. And not only what you learn, your perception, how you think about the whole process. Like going into labor worried and anxious is only going to make you more worried and anxious. I've seen it. I have seen it to the point where moms had to take some type of anxiety medication to go through with their C-section. There's a lot that goes into preparing for birth. Again, not only physically, mentally, spiritually, just everything, the whole package. So a lot of people actually focus on memorizing information too. And that's not confidence. Confidence comes from not only knowing the information, but understanding the information, or understanding the information. Understanding that you can get an epidural or pain meds and what they are. That's one thing, but do you know that you have a choice not to do anything at all, not to take any pain medication and things like that? There are some people out here that they don't know that. I didn't. I thought that you just do whatever the doctor tells you to do. You go to the hospital, you follow all the instructions. They tell you, okay, I think you should get an epidural now, and you get your epidural. That is the way I thought it was. And I have also encountered clients of my own that think that that's the way things go. When I told a specific mom that I remember that you don't have to get the epidural, you can go through pain medication through your IV first, or you just don't have to do anything at all. And she's like, what? I don't have to do this, or I don't have to do that. So I'm trying to think other things, like if you're scheduled for an induction and everything's okay with baby, everything's okay with you, you're not high risk, but they just don't want you to go past a certain time before your due date. For whatever reason, some providers just have a preference of getting things going beforehand, but you do have an option to not go into that induction appointment. Just again, things that you may not know. But confidence is also understanding what's happening in your body, understanding your options again, and understanding how things can actually unfold and how to respond to them, even as they come at you in the moment. And this is what I do as a doula. I go over different topics and scenarios that can possibly take place. And if I see things going differently, then, we have conversations about all possible things that could take place and, how to maneuver down this new path. Because thinking of, birth plans and things like that, a lot of the time moms think that, okay, I have this birth plan, this is how things are going to go. And that's not always the case. That birth plan is just to let you know what options you have. That's not necessarily how everything is going to go in what order they go in, And another thing that helps to build confidence is knowing that you don't have to decide everything early in pregnancy. Like, you have time to learn things. You have time to ask all the questions. You have time to make connections with your midwife or your OB, your doula. You have time to make these connections and figure things out and what feels ultimately right for you. Ask all of the questions. Use all of your resources. We have social media now where you can find a lot of information. It can be a bit overwhelming because you have so much information at your fingertips, and then you have to differentiate, or discern what is actual information that you need, and is this true? And can I utilize this information in my case? So these are some things that I like to go over with my personal clients as well. Another thing, confidence also comes from your environment itself, and the people that are around you in that moment. I've talked about this in previous episodes. Having people who are calm and supportive, they actually make a difference to build that environment to be like, okay, I got these people, they got my back, and I can do this. But you can only do that if you have those positive, supportive people in your corner. Make sure and choose the right people to be in your birth space. You need nothing but positivity during this experience. You do not need people being distracted, falling asleep, maybe even playing the game, watching TV, people who are anxious that are, making you anxious just because they're anxious. You're feeding off of their energy. You need people that are gonna assist in any way that you really need them, especially in a hospital setting. In the hospital setting, you can't eat. So maybe that also looks like somebody who knows that if they need to eat something, if it's been hours and hours and hours, because you can't eat, they're going to go to the cafeteria, go downstairs, go to the waiting room, go to their car and have something to eat and then come back. They're not going to eat in your face. To each his own. Some moms are okay with that. But these are things that, again, I've seen. So overall, just people who's going to respect you, your environment, and your decisions. And then this is a big one. Confidence also comes from trusting yourself. It's not just about what you're told. It's about what feels right for you in that particular moment. There's a lot of ups and downs when it comes to labor. especially for, first time moms. You don't know what's going on. You don't know what's happening next. And a lot of moms are afraid of the unknown, but again, that preparation in the beginning and in the early stages of pregnancy, that alone can build confidence in the experience and in yourself. And when you have that combination of understanding, or again, understanding, support, and self-trust, you move differently going into birth. You have a whole new mindset. You're not walking in just hoping for the best. You're walking in feeling prepared for whatever you may experience during that time. And again, this is what I really focus on when I prepare moms, not just giving them information, but helping them to feel like more grounded, more confident, going into their experience, because I give them all options. I answer as many questions as I want, or I need to, rather, as many questions as you want. I consider myself to be your birth bestie, when you hire me as your doula, because getting in contact with your provider in the middle of the night or after hours is usually impossible, unless you have like a really cool midwife or whatnot. But especially OB practices and things like that, it's hard to get a hold of somebody when you're experiencing things, or you just a question just pops up and you gotta wait 3-4 days, maybe even a week, to get that question answered, or those questions answered. As your doula, as your educator, as your instructor, I will answer your questions as best as I can, And that's why I feel like this is not a job for me. This is not a hobby for me. This is a calling on my life. It's when it comes to birth, I like to make sure that my clients are as confident as possible, because confidence is not about control. Especially when it comes to birth, it's about how you show up in that moment. Prepared. And when that's in place, trust me, everything feels different. Trust the process. Have a better understanding of what's going on, different options and different pathways. Have that support with you, that positive support with you. And then also trust yourself again. Your body knows what it's doing. It was made for this. It was designed for this. If it wasn't, it would not be in this predicament. So remember to build that confidence, because it matters. So if this episode helps you feel a little more clear, a little more grounded, and a little more prepared, then I'm glad you're here. Make sure you're subscribed so you don't miss the next session. And if this resonated with you, please share this with someone you know who might need it. I'll talk to you in the next one. Peace, blessings, and abundance. Thanks for watching.